2, 1.
What's up, guys? We are back just off of the curriculum with Matt Gildersleeve and the rest of the University of Buffalo strength and conditioning staff. So we went over my top 5 stretches that I give away. Now we're going to just throw a couple videos together to kind of show you. So this is a very fast version of what we do. But basically the first one is going to be small foot. We talked about it in the podcast. And small foot activation is going to start, we talked about the tripod. So here, here, and here, not to get too fancy. Plant that on the foot. That is the tripod we create. And we want to generate that torque from the foot and get the small foot to activate. So I'm trying to approximate these 2 portions of my feet together, and it creates that stable arch. When that arch is stable, I don't collapse in and causing valgus deformities into my knee or any issues up chain. So that's the small foot. Number 2 is hip flexor. So hip flexor is going to be banded. I do this a lot. We go over this a ton with our athletes because it really helps open up our hip flexion or hip extension. So we are going into this position. Big misses we usually see is people like to hyperextend. Try not to do that. Try to keep stacked, pelvic floor and diaphragm square. We're going to lean in. You can even drive this down a little more to add a little spice to it. Give a nice little glute squeeze at the end here. Boom. Really helps open that anterior capsule of the front of the hip here. Anywhere from like 2 minutes, depending on what you're doing. We can go down that rabbit hole later. Next is going to be lateral quad. So lateral quad with the PVC pipe. We talked about the IT band and the lateral quad, and we want to get those sliding better. So hop down. I'm going to not lay on my IT band. I'm going to go onto my elbow here, and I'm going to roll a little bit onto my lateral quad. Put this leg on the ground, and then I'm flexing and extending. That's where the money is, flexion and extension. I'll go all the way up, flex and extend, couple reps, go up higher, flex and extend. All we're doing is creating that slide glide between the tissues. This is kind of a 6th bonus factor here. So same thing, but we do this a lot with our scap. So we're going right here between the scap and the spine, and we are going to lay it on the ground. Boom. And we're going to do 10 passes up and down, and then move up a little bit, 10 passes, and 3 to 4 different spots between the spine and the scapula. There's a little gap of tissue we want to hit. That's again going to create that tissue, mobilize that tissue so we can get in overhead positions more. Next one is T-spine rotation. This is probably one of my all-time favorites. It's kind of hard to explain, so I have to do it in 3 steps. So I'm going to hinge. So a full hinge is going to look like this. And then when I get to the, so you can see it from the front, it's a hinge. Far hand goes under. I then rotate, and then I press away. Okay? The reason I'm hinging is so I don't rotate from my lumbar spine. I'm isolating my thoracic or mid-back, and I'm getting in this position, and I'm really creating that tension under things called the facets and creating more range of motion. So I'll do that both sides. And the last one is the rig stretch or the lat stretch. We talked about opening up that lat so we can have more range of motion when pressing overhead. Again, the lacrosse ball in the back can help with that, and this is going to help also. So what you want to do is find a spot on a rig or a doorway. I'm going to grab low with my close hand, far leg sweeps behind, close to the rig. So I'm kind of just hanging like this. But the important thing is bringing this hand up, and then I'm leaning, trying to open up like a bow and arrow here on the bow. Here's the arrow. But anyways, so getting in this position, I'm going to scour around, move. Sometimes I like to flip, and I'll get a different spot, maybe down closer to my QL. But really opening up this lateral chain to help me get into that overhead position. Okay? Thanks again. We'll talk to you guys soon.